my name is Levin, and today I will be presenting on antibiotic resistance, how a novel treatment turned into a global health crisis. A little bit about me. I'm a rising senior at Staten Island Technical High School. I'm a resident of Staten Island, New York. I'm involved in the varsity tennis and table tennis teams, biological and neurological research at a lab on naked mole rats, a medical clinic intern. I'm involved in a neuroscience mentorship program, and I'm an aspiring physician. So before we get into everything, here are some statistics about antibiotic resistance. Antimicrobial resistance was totally responsible for 1.27 million deaths worldwide and contributed to 4.95 million deaths in 2019. Estimates from the World Bank show that antimicrobial resistance could result in $1 trillion in additional costs to healthcare by 2050. And over 500,000 lives could be saved yearly with effective use of vaccinations and continued development of vaccines. But what is antimicrobial resistance or antibiotic resistance? So the body hosts trillions of bacteria in the body, and most are beneficial and even necessary for the body to properly function. However, other bacteria is incredibly invasive. It invades the body and replicates rapidly and can result in harm and death, disease, etc. So antibiotics were created. Mortality from bacterial infections used to be very high, but the development of antibiotics through tablets, injections, topical creams has helped kill most bacteria in all individuals and leaves just a few for the immune system to kill fairly easily. Antibiotics help kill off bacteria in a multitude of ways. So bacteria are very complex organisms. Antibiotics can harm infectious bacteria by interfering with metabolism, attacking DNA to prevent replication, and or rip out the outer layer or membrane, leaving its inside machinery to escape. However, evolution has complicated the success of antibiotics, as certain bacteria have evolved through mutations to become immune to such antibiotics. This would be sort of natural selection, where only the fittest of individuals survive despite facing similar circumstances. And the image, the figure on the right, shows the mechanisms of antibiotic resistance. So here you can read that. And here I will discuss the immunity spreading of bacteria, which thus results in a superbug. So how bacteria spreads immunity? Bacteria has DNA in the form of chromosomes like us humans, but also through plasmids, which are circular DNA often found in fungi and yeast. Conjugation is, simply put, the physical contact between bacteria and the transmission of plasmids, which can have immunity. Reproduction of immune bacteria can also result in future generations of immunity, and death upon certain bacterium can result in other bacteria picking up their DNA and thus becoming immune as well. And so we have a forming of a superbug, which is bacteria resistant to multiple forms of antibiotics, and it is a major global health threat, largely thanks to the widespread use of antibiotics. This has already been seen with certain strains of bacteria, such as Staphylococcus aureus, or staph infections, which causes infections of various organs, body parts, such as the skin, chest area, digestive system, and even bones. And they have developed into MRSA, which is methicillin-resistant Staphylococcus aureus, and it has become resistant to antibiotics used to treat ordinary staph infections. These superbugs are incredibly prevalent in hospitals and nursing homes where thorough disinfection cleaning may not be necessarily occurring often enough in the face of infected patients. Antibiotics are often advertised as a sort of widespread commodity and used to treat any sort of ailment, even when not necessary. Frequent exposure to antibiotics in the body can lead to resistant bacteria, so it is pivotal for people to minimize usage. In less developed areas of the world, antibiotics are scarce, while in countries such as America, antibiotics are prescribed and consumed far too carelessly. Another place for antibiotic resistance is the meat industry, which is then consumed by humans who eat meat. So animals for meat production are kept in horrendous conditions. They're cramped with one another in cages that are not kept clean, and thus being another site for antibiotic resistance. As you can see on the image on the right, this is a photo of pigs kept in a sort of cramped facility for meat production. To keep the animals healthy, they're fed drugs made for humans rather than being kept in more sanitary, better conditions. And antibiotic resistance is transmitted first between the livestock and then transmitted to humans. This is already seen with colistin. So colicin is an incredibly powerful antibiotic. It was created in 1959, and it was used as a sort of last resort for very ill patients because it has shown to damage the liver intensely. Colicin has been fed to pigs for years, and antibiotic resistance has developed, spreading initially from animal to animal and then to humans. However, this is not meant to scare. This is merely meant to be informative. Scientists are hard at work in developing measures to prevent the further spread of superbugs. Phage therapy is an example. So a phage is a virus and bacteria, like bacteriophage, and it is possible to use phages to kill other bacteria. So phages were heavily studied in the 20th century, so we really understand them. OMKL1, which is outer membrane knockout 1, is a bacteriophage used to kill Pseudomonas or ruginosa. And what happens is the bacteria is usually able to get rid of the OMKL1, or like with other bacteria, get rid of the phage by changing their efflux pump mechanism, which is kind of like a channel to kick things out. However, once this change occurs, the bacteria is now extremely susceptible for being killed with antibiotics, even if it was immune, as the removal of the efflux pump mechanism now disturbs their ability to kick out the antibiotics that enter them. What can you do? So obviously, we are high schoolers, most of us here attending the conference, and so we don't really have much power, but you can help stop the spread of superbugs within yourself by avoiding taking antibiotics with a virus. So a virus, it is not a cell, it does not have a cell membrane, and thus antibiotics do not work against it. They don't really help it. So it is just completely unnecessary. And also, you must try to take antibiotics exactly as prescribed. So do not skip doses or save antibiotics for later use. If you get sick again, take antibiotics. Do not take antibiotics unless directly prescribed for you. So don't take your parents' antibiotics from years ago that you think may help treat. Always consult a medical professional before doing so. And also just try to avoid taking it unless absolutely necessary. Here are my references, and thank you so much for attending my student speaker series. I hope this was informative, and if you have any questions, please reach out to me at elevenrachel@gmail.com, and here's the link to my LinkedIn. Thank you. Bye.